Good day, everyone. Welcome to our talk show today. We'll be talking on corticosteroids in treatment of asthma. And I have here, my name is Ogege Chamaka Akit, and I have here,
Anide Gloria.
Chime Chime. Okay, we'll be learning from each other today, and I'm sure you will learn a lot more today too. So, Gloria, can you tell us about corticosteroids and what is asthma?
Okay, so we're going to be starting the definition of these terms. Firstly, asthma is an inflammatory disorder of the airway, and then corticosteroids, as we are seeing on the board, are medications that mimic the actions of cortisol. And cortisol are natural hormones that are produced by the adrenal glands. These corticosteroids they aid in reduction of inflammation and swelling, which are usually released by inflammatory cytokines like leukotriene, prostaglandins, and everything. So, example of these corticosteroids we have here, we're talking about three main types of corticosteroids today. The first one we're talking about inhaled corticosteroids. These drugs are usually administered by the use of inhalers, by inhalation therapy, stuff like that. So the first example we're going to have now is beclomethasone and budesonide. Now we go straight to oral corticosteroids. These corticosteroids are administered orally. Example, we have the prednisolone and the rest. So thirdly, we have the IECs. These are intravenous corticosteroids. They are given directly into the vein. Usually for when asthma becomes too serious. So they are given for fast relief, stuff like that. So example, we have the prednisolone and the what's the name of that? Dexamethasone. Yes. So Divine, can you tell us a little about the mechanism of actions of these drugs and how they work?
Thank you very much for that. Actually, every drug to work, it has some processes it needs to take. But actually, I will be commenting on the mechanism of action of mostly how the drug works. I will not be taking a specific whether inhaled or intravenous or orally corticosteroids. So I will be taking it gradually, like the mechanism of action, how they work after they have been absorbed by the lungs or the liver. As for those that might do first pass effect, as case may be. So this corticosteroid we're talking about, actually it binds to glucocorticoid binding receptor. So when it binds to this glucocorticoid binding receptor, which is another class of drug for treating asthma as well, because this corticosteroid itself doesn't bind to corticosteroid binding receptor, rather it binds to glucocorticoid binding receptor. So when this drug binds to this glucocorticoid binding receptor, it is being transferred or being carried by a vehicle which can take it into the cell. And when it's being taken into the cell, it's going to bind to the glucocorticoid receptor enzyme. So when this drug binds to there are so many effects that it can carry out. Something like being an immune suppressive agent. Understand? It suppresses the immune of some of these white blood cells that cause some inflammatory mediator producers, and as well it can be as a suppressant, as case may be. It can be as an anti-inflammatory, strong anti-inflammatory drug as case may be. So when the drug is being carried into the cell by the glucocorticoid, so binding enzyme, when it's being inside there, it's going to activate or transactivate. When it transactivates, which enzyme is it going to transactivate? Because normally it needs to transactivate an enzyme, and which is RNA. Understand? So most of these drugs, when they go inside the system, we have some enzyme, but mostly what we need to know much is about knowing about the RNA and the protein synthesis, which are classically involved in these transcription activities of a thing. Understand? So when it is being activated, it is going to cause some inflammatory inhibitors. So when it inhibits, when it have activated this RNA, that is when it has transactivated this RNA, is going to bring about suppressive. Understand? Going to be about, it brings about suppressive, and it brings about the suppressive only when the messenger RNA is not modulated. So, and as a immune suppressive, how does it do that? Or anti-inflammatory activity, how can it do that? For instance, we need to know that it's a phospholipid. Phospholipid is an enzyme that is being produced by the same membrane, the same membrane that is hematocrit. So this phospholipid is being converted to arachidonic acid by phospholipid A. So this phospholipid A, this glucocorticoid is going to inhibit the binding, the conversion. The conversion of this phospholipid to that is going to bring more about reactivation. The cyclooxygenase 1 is no more going to produce, and because cyclooxygenase 1 is no more going to produce, inflammatory mediators are nowhere to be found.
Yeah.
And because if inflammatory mediators are nowhere to be found, there is no way you tell me that Asthma can be produced anymore.
Yes.
So you understand? So that is what much we know about this binding of it. So when it binds, carried by the vehicle, as it being carried by the vehicle, it's going to bring about some changes, mechanical changes, synthetic changes, and other things. So I think that is so.
Thank you so much for that.
Detailed.
Explanation. Really detailed. Okay, it's good as you're taking your medicine, you know how it works, you know the mechanism of action. Yes, mechanism of action of corticosteroids. Okay, I know we all have people living with asthma around us and possibly might be having asthma too. So we want to know the benefits of these corticosteroids. Corticosteroids have proved a vital component in asthma therapy because of its effect. It has the potential to reduce asthmatic attack by reducing the airway inflammation, reducing swelling and mucus.
It improves, the quality of life. When you are not sick, yes, it reduces the way you spend money. Like primarily, if you're not sick, you will not go to hospital, stuff like that. So, they help.
I know that use of corticosteroids improves lung function. It makes breathing easier. Because one thing about asthma patients is that they experience wheezing, like they find it difficult to breathe. Yeah. So use of corticosteroids helps too. So, okay, so taking the side effects.
I'll be taking you on the side effects of corticosteroids. One of the side effects of corticosteroids, even the main one for inhaled, is oral thrush. When someone takes oral corticosteroid and they don't rinse their mouth, there are tendencies of getting that oral thrush, which is also known as oral candidiasis. And then another side effect is increased appetite. So when your appetite increases, you also get to gain weight from that increase in appetite.
Yes, too much.
Yes, as well. And you also get something called hyperglycemia. That's increase in glucose in your body system. And as well, long-term use of these corticosteroid can cause something called osteoporosis. That's as much as the calcium in your body is being produced, it will be breaking down so fast because you've used corticosteroids for a very long period of time. We'll go to talk about the precautions now. When you're using corticosteroids for a long period of time, there are tendencies that you might start to have systemic side effects, and it's important that you monitor those corticosteroids intake to prevent having serious systemic side effects.
Yes.
And when someone, especially pregnant women, when they take these corticosteroids, it's advisable that they take it in moderation. There's that caution towards it that they have to take it in a minimal amount, because if not, their children will be born prematurely and they will have something called lip cliff on their lips. And then you should always follow your doctor's prescription. Honestly, they are.
Yes, to avoid overdose and yes, to avoid severe adverse reaction.
Backing and withdrawal, like it's important. Don't just stop taking corticosteroids just like that. It's a gradual process. I hope this video was helpful for everybody that watched.
Thank you so much for listening and giving us your attention. We hope to see you in our next